we concentrate so much on women's disorders because women tend to go to doctors more than men, but actually men have some very common and some very serious problems as well. So in this program, we'll be talking about men's health issues. So we hope you'll join us.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
Some of men's health issues are of a serious nature. And I'd like to start out talking about one of those, and that's the subject of prostatitis. Prostatitis can be of two kinds. It can be acute or it can be chronic. The acute form can be really quite serious, so that it can cause high fevers and chills, loss of appetite, backaches, perineal pain, the floor of the pelvis can be really quite severe. And such a man may be actually prostrate, just so weak and so sick that he can't get out of bed. There are a number of things that can be done for him, and he needs to work diligently on applying these, because if he's careful in applying them, it will be less likely that he will get a chronic prostatitis. Some men describe the hot, tender, very painful prostate with acute prostatitis as being a hot stone in the rectum, and that certainly could be a way to describe it. Now, since there are a number of germs that can be involved in acute prostatitis, we almost always get something like the colon bacteria that are so common in the colon. We almost always get those. Sometimes we need to massage the prostate in order to get secretions to culture, but most of the time, if we just wait a day or so, we can get from the urine the same bacteria, even sometimes from the very beginning. We can get the pathogenic bacterium that's causing the problem with the prostate from the urine, which means that we don't have to massage the prostate, which by massaging can release germs into the bloodstream, which could cause the germs to go all over the body. Of course, we're always concerned in people who have some kind of heart problem that if the germs go all over the body, then the individual has the possibility, although it's not very great, but it is a possibility that they will grow on the abnormal place in the heart. Now, with prostatitis, there are certain antimicrobials that are of an herbal nature that I'd like to tell you about. Of course, everybody is familiar with golden seal and echinacea as herbal antimicrobial agents, and I can recommend these for people who have acute prostatitis. Garlic is another antimicrobial, along with elderberry. Myrrh is a very good antimicrobial. Calendula is very good for the prostate. And one that I like very much is also grapefruit seed extract. It's a very good antimicrobial substance that can be used in acute prostatitis. Now, if one is very careful to treat oneself during the acute phase, then there is a much less likelihood that it will go on to the chronic phase of prostatitis. The chronic phase gives a little pain, sometimes a little pus in the urine, sometimes a little sense of fullness in the pelvic area, and often it just sort of subdues the man's sense of well-being somewhat. So we want to avoid that if it's at all possible. Now, along with prostatitis, there is another topic that men often suffer from, and I have asked Dr. Don Miller to talk with you about that one, and that is the subject of impotence in men. It's getting to be a more common problem, and I think some of the issues that are involved would be well to discuss at this time. Dr. Miller?
Okay. You know, I get a magazine called, is my VFW magazine, and in every issue there will be a whole large page advertisement for this particular problem. They usually either call it impotence or erectile dysfunction, and this is a major problem, usually having to do with a man when he gets a little bit older. And I would say probably it's not so much a problem of itself, although it is a problem, but it's more of a symptom of another problem. And there are some rather simple things you can try to take care of this problem. Basically, the thing's going to be a circulation problem. For some reason, the circulation of the blood down in that part of the body has been somehow impaired, and when you have the impairment of the blood flow, you have impotence. There are various things that keep us from having good circulation, and some of them we've done other programs on. Something like diabetes. A person who's diabetic is far more likely to be impotent than the person who is not diabetic. And so what should you do? You should do the things in your life that will keep you from being diabetic. Eating the right foods, getting the exercise. But also another thing that keeps us from having good blood flow in any part of the body. We're not just talking about impotence here, we're talking about the whole body. Let me go back to one of the foundational health principles. I always, whenever I teach health principles, I teach two foundational principles. One is the life is in the blood, but the second one is perfect health requires perfect circulation. Anything that impairs circulation is going to cause us not to be as healthy as we can be, which is the problem with impotence. So drinking more water. A person who is impotent may be the fact that they just don't drink water enough, their blood is too viscous, and therefore they're not getting the good blood flow in that part of the body. Another thing can be tobacco. We realize that tobacco damages peripheral blood circulation. You'll see many people who are really hooked on the tobacco. If they go there long enough, they start to have amputations because they start losing the circulation in their periphery. Alcohol certainly can be a potent cause of impotence. It's a funny way of putting it, a potent cause of impotence. So we need to stay away from the alcohol. As a matter of fact, anything stimulating along those lines are bad for the prostate, bad for the impotence. Another thing you need to do is make sure that you stay away from overstimulation. A person sometimes is impotent because they have for so long stayed so overstimulated in the sexual areas. Basically, you're talking about people who are into, let's say, pornography, or in any of its forms. A person who so wears out their apparatus that it just doesn't work anymore, it's best to sit there and make sure you have a pure mind. I would recommend to a person who is impotent, and I've ran into these people in India, I want them to stay completely away from anything stimulating for at least a month. Stay away from their wives, stay away from anything that might stimulate them, keep their minds on a higher level, and perhaps sometimes through this time out, your body can recover enough. But then I also recommend the other things, keep the blood flowing well. You can do things called hot and cold sitz baths. Basically, sitting in a contrast bath, you sit in hot water for 3 minutes, go into cold water for 30 seconds, back to hot water for 3 minutes, 30 seconds into cold. This vasoconstriction, vasodilation can help to increase blood flow. We have them do that for things like arthritis to the hand and other things. It can work the same way in the pelvic area. It's also good for the prostate while you're at it. So doing the hot and cold sitz baths would be very beneficial for the person having this problem. There are certain herbs that a person can take, and almost anything to do with the prostate. Saw palmetto berries is extremely good. So I would recommend a person try saw palmetto berries because sometimes impotence, some people consider that also along the lines of male infertility. Saw palmetto berries will help that. Ginger will help that. Dr. Thrash has mentioned ginger for the woman. Ginger for the man could also be quite beneficial. And then I've read recently that people who are really into bicycling, I mean getting onto those little banana seats and doing long-term bicycling, they can become impotent because of the damage being done to the vascular system leading into the area that's under question here. Also, any type of injury to that area. You find many young people today out there playing the soccer, they get kicked in the wrong places. That itself can lead to impotence in the future because of damage to the vascular area. So we need to protect every part of our body, and if you're concerned about impotence, protect that part of your body. Stay away from those little narrow seats. Don't sit on hard surfaces. You need good blood flow at all time. Remember, perfect health requires perfect circulation. That goes for your prostate, that goes for everything that you have, your eyes, everything needs to have good circulation. I think as we keep the circulation going, Dr. Thrash, we'll be a lot better off.
Yes. Now, circulation is so important that it involves not only the impotence thing, but it also involves infertility. So if a man has impotence, it's probable that he will also have infertility. Now, infertility is fairly easy to study in a man, not so with a woman. It's much more difficult with women to study infertility, but with men, usually a sample of the semen is all that's needed, and the answer is evident pretty shortly. But there are some things about impotence that may be correctable, even surgically, that a man should know about, and those are varicoceles, little tumors of the testis, wearing tight pants, wearing tight shorts, taking hot baths. All of these as a regular thing. A hot bath, a single hot bath, can, after a few days, actually enhance the production of spermatozoa. But if these are regular, every day, hot baths for half an hour to an hour, then that can reduce the production of spermatozoa and can make it so that the man is more or less impotent. Then such things as smoking and drinking, they have their influence not only on impotence, but also on infertility. The influence of drugs is quite enormous. That's even over-the-counter types of drugs. These things can make so much of an influence on the man's health or on his fertility that the couple can be infertile. Now, a couple of things that don't directly deal with infertility but should be considered. One is that it's child abuse to continue any kind of indulgence that makes a problem in the prenatal area for the child, such things as smoking. A woman should consider, and a man as well, because the smoking in a man can also involve the unborn child in an atmosphere that makes it so that the child is less likely to be able to develop a good blood vessel system. And so the man as well as the woman should not be smoking during the pregnancy time, or ideally for some time prior to the onset of the pregnancy. And the lifestyle does have a great influence on the unborn child and should be carefully studied. Probably the commonest affliction of older men is that of benign prostatic hypertrophy. This condition is not universal, but nearly so as a man gets older. And so Dr. Miller is going to talk with you about some things having to do with benign prostatic hypertrophy.
You know, sometimes when we study how not to get a disease, we like to study populations that don't have that disease. If you want to not to get osteoporosis, find a population that does not get osteoporosis, find out how they live. You won't get osteoporosis, or at least why you greatly lessen your opportunities and your chances of getting osteoporosis. So I read an interesting study not long ago about a certain class that do not get prostate problems, especially this one that Dr. Thrash has just mentioned, and that is wild dogs. Wild dogs are found not to have this enlargement of the prostate. But domestic dogs almost all have the enlargement of the prostate. What's the difference? Well, I've been down in Africa and I've seen the wild dogs, the real wild dogs, and basically when a wild dog gets the urge, the wild dog takes care of the urge. But a domestic dog, locked up in that house all day long, he feels the urge, saying, I really got to go to the bathroom. But he remembers when he was 3 months old having his nose pushed down into a newspaper where he had piddled, not on the carpet, and being beat by a newspaper and told, you've got to do it over here. And that dog will hold itself the entire day long. I remember I used to come home when I was a child and take our dog for a walk and wondered why that dog could go to the bathroom 27 times from our house to the corner and back. It's because that dog was retaining its urine, and the retention of the urine has been placed with the problem with benign prostate hyperplasia or hypertrophy, however you want to put it. And so we need to make sure that when we get the urge, we go to the bathroom right then. But we're in a society right now that we hold it, and hold it, and it's the holding of it that's going to cause lots of different types of problem. The best thing to do for once you have the, well, let's talk about what's causing this problem, is over-engorgement of the prostate on a regular basis. Again, this gets back to the point of overstimulation. A person who continually keeps himself aroused, sexually aroused, will have an engorgement because basically the prostate is a part of the reproductive system. It provides some of the fluids that propels the semen, and so it becomes engorged every time a man gets aroused. It's sort of like a balloon. You know, when you take a balloon and you blow it up for the first time, it's pretty tough to blow up. But every time you blow it, it gets a little bit easier, and it gets a little bit distended. It sort of stays larger as you're doing this. Same thing with the prostate. The prostate's about the size of a walnut. And basically it's an organ that has a hole through the middle through which your urethra comes. And when you start to get this engorgement, it swells. Now when it swells, much like the appendix, it swells out and it swells in. And it pinches down, and that's why many people who have this problem have the process or the problem of urgency. They feel like they got to go to the bathroom, but they're not able to produce much urine. They've got frequency because they're not voiding all the way, their bladder's staying full. They have many, many trips to the bathroom, but only void a small amount. So the frequency and the urgency are signs that you've got prostate problems. So what can you do about this? One, don't become overstimulated all the time. Stay away from those things that stimulate you or arouse you. They're very bad. Matter of fact, even taking stimulating foods, spices, alcohol, taking tobacco, all will affect that prostate gland. It's in a very innocuous place, but it's down there where it's going to get into some problems with your lifestyle. You can also make sure that your blood flow is good, keeping the blood less viscous by drinking plenty of water. But there are some good things you can do to take care of it. I've already mentioned the saw palmettos, probably one of the best things you can do for the prostate. Eating red and orange fruits and vegetables, extremely good prostate food. Zinc is a food that the prostate needs a lot of. So where do you get the zinc? Well, you can buy the little pills, but you can also take things like popcorn, you can take things like pumpkin seeds, both of which are very good forms of zinc. And there are other herbs that you can take, and you can look up in an herb book and try to find some of these, whatever herbs are available in your area. Herbs that will help you diurese a little bit more would also be good for the prostate. And trying to eliminate the congestion in the prostate area, and I would recommend, again, the hot sitz baths, sitting in the hot water and in the cold water, this fluxion of the water in and out. Now, I've had patients before that needed basically on a daily basis while they were under my care, a prostate massage, basically inserting a digit into the anus and then into the rectum and massaging that prostate to try to expel some of the fluid in there. And we find that sometimes this is effective in lessening the size of the prostate and letting it go down to where it's not going to be such a problem with the rest of the body. So those are some simple things you can do for the prostate.
Very simple, very nice things. And recently there have been these probes that can be inserted into the rectum that deliver heat. And that can help to soothe the prostate, and sometimes in acute prostatitis, in chronic prostatitis, in benign prostatic hypertrophy, and in cancer of the prostate. All of these conditions will sometimes respond to the heated probe that is now available on the market. I'd like to talk with you a little bit about cancer of the prostate in men. This is a fairly common disorder in men and a moderately serious problem. There are two general types of prostatic cancer. One is a fast-growing type, and the other is a very slow-growing type. Generally, men in the Orient, in Asia, they tend to have the slow-growing kind, whereas in the Western world, men generally tend to have more the fast-growing type, or the faster-growing than that in Asia. An Asian man may get cancer of the prostate and may die of something else after 15 or 20 years of knowing that he has cancer of the prostate. So it grows very slowly, is what we might call almost innocuous. It can pick up speed and eventually kill the man, but most of the time in Asia, the disease is not as rapid growing as it is in the Western world. Past the age of 65, the commonest cancer in men is prostate cancer. Now, with proper treatment, most men can expect that, or at least 65% of men can expect that they can survive 10 years or more. They may still have cancer of the prostate, but it has been so slow growing, and the treatment has been the kind that can help a good bit with the prostate cancer. If a man gets prostate cancer, he should study the kinds of treatments that are available. There are many different kinds, all the way from natural treatments to very high-tech types of treatment for cancer of the prostate. With most of these, or many of these, he can expect a good 10-year survival rate without serious problems with the cancer. Now, an interesting feature about cancer of the prostate is that it can metastasize quite widely throughout a lot of the bones, the liver, and other areas, and still not cause a lot of symptoms. That's an interesting feature about cancer of the prostate. The first cancer of the prostate that I ever saw when I was in medical school was just such a cancer. The man had metastases everywhere by the time he died. And he died at quite an old age. As I recall, he was well into his 80s and still had good function and very few symptoms. Now, what are the causes of cancer of the prostate? Generally speaking, experts in this area will say that we don't know what causes cancer of the prostate, but inactivity is one of those things that we can feel pretty certain is a problem with cancer of the prostate. And some people feel that the massaging action of the muscles of the pelvic floor and the muscles of the buttocks may be a part of that keeps the prostate in very good health. We know also that high-fat diet, a diet high in animal products, these are also likely to be a part of what we could be a part of the cause of prostate cancer. Now, from a natural standpoint, there are a number of things that will enhance the treatment of cancer of the prostate, and many of these are what can be called hormone modulators. There are a number of herbal types of hormone modulators, and the best known of these for men is saw palmetto berry. This herb has a very good ability to inhibit the functioning of 5-alpha reductase, which of course then gives it some inhibition of the growth of prostate cancer. Now, there are also some anti-neoplastic herbs, and one of those is soy. I'm very interested in the new research that's going on in many university centers about soy. And one of the things that we know about soy is that it has anti-neoplastic properties. We know that breast cancer is definitely inhibited by the various constituents of soy. Some of these constituents, the most common is the isoflavone, but then in addition to the isoflavones, there are some others like protease inhibitors and saponins and inositol phosphohexate. All of these are constituents of soybeans that make them very beneficial as an anti-neoplastic agent. Now, in addition to the soy, there are other anti-neoplastic or anti-cancer types of foods, such as flaxseed. Now, the isoflavones are largely responsible in soy, but the lignans are responsible in flaxseed for the anti-malignancy or anti-neoplastic factors. And they are phytoestrogens, just like the isoflavones, but they work in a slightly different way. So if one mixes both flaxseed and soybeans, and it is soybeans, I prefer the soybeans to any kind of product made from soybeans when we're treating cancer or treating any other kind of serious problem. So I'd use the flaxseed freshly ground. Don't grind a quart of flaxseed and put that in the refrigerator, even in a dark jar. Just wait until the very time that you're ready to eat them and then grind the flaxseed. With flaxseed, the androgen levels fall. Now, androgens are male sex hormones, and we know for certain that male sex hormones are involved in the production of benign prostatic hypertrophy and prostate cancer. There are a number of other hormone modulators in the herbal world, and I'd just like to read you a list of some of these. Licorice is one of those. The glycyrrhiza compounds in licorice root makes it so that it's a very good anti-neoplastic and hormone modulator, which can be beneficial in cancer of the prostate. Skullcap, Asian and American ginseng, both of them are very helpful. Chaste tree, which we usually think of in dealing with women's problems, but chaste tree is also extremely good for men with prostate cancer. Partridge berry, false unicorn, and vitamin D. Vitamin D is almost always low in men who have cancer of the prostate. So take a good dose of vitamin D as a supplement, and that can be helpful in cancer of the prostate. Now, anything that will boost the immune system in a man with cancer of the prostate is quite helpful. Exercise, hydrotherapy, that means hot baths, or this probe that I was mentioning can be helpful. And of course, echinacea is very good. Eupatorium, Venus flytrap, comfrey. Now, we don't recommend taking comfrey more than 3 months at one stretch because of the possibility, I'm not sure that it's a probability, but the possibility of some kind of liver damage. And then astragalus, ashwagandha, and zinc and selenium. Now, I hope with this very brief discussion that you have received some information that will help you with prostate cancer and all other men's problems.